Hi everyone, welcome to my channel. I'm glad to see you today. Thank you for subscribing. I'm so grateful to you for returning. For those of you who don't know me, my name is Dr. Florence Oswofa. I'm a licensed professional counselor. And in this channel, we're going to be talking about mental health issues, relationships, parenting, and whatever you want me to talk about, I'll be here for you. So please don't forget to like, comment, subscribe, and share. So when I upload my next video, you'll be the first to see it. Okay, thank you so much. So today I'm going to be talking about trauma and stressor-related disorders. In this category, we have reactive attachment disorder, followed by disinhibited social engagement disorder. By this, I mean a pattern of antisocial behavior, for example, aggression, sensation seeking or risky behaviors, wandering from caregivers, for example, okay, and culturally inappropriate behaviors, okay. Next, we have the PTSD, which is post-traumatic stress disorder. So by that we mean what happens after you experience some stress or disorder, okay. Normally, if you've gone through or experienced an event within a month, that is up to a month, you're still feeling, not yourself, or you're still not okay, it's time to see your professional, a mental health professional, okay, or your doctor to tell them how you're feeling. If you see having any of those experiences, any of those, some of the criteria that I'm going to mention as we get into this video. The next is acute stress disorder, acute short-term disorder that just happened, like maybe loss of a job or somebody just criticizes you, kind of something you experience. It's not for a very long time, but at least within a month, you still feel flashbacks or you still feel very down, recurring events, then it's time for you to see your doctor or your professional, mental health professional. Next comes adjustment stress disorder. Okay, this happens when people have just experienced an event and they're not able to adjust to their normal functioning system or how they live, So this normally happens within 3 months. Maybe they're still feeling sad. Maybe after the death of a loved one, feeling hopeless, feel worried, so many things like that. Within 3 months, you're still not feeling yourself and you're dying. It's time to see your doctor. Okay. So according to the diagnostic statistical manual for mental health disorders, so it's just a manual, a book. Doctors use the criteria they use for diagnosing or assessing any kind of illness, particularly mental health, So it's a book. So when I say diagnostics statistical manual for mental health, so this is a manual, like I said, right? Defines PTSD or all these trauma-related stressors as an event that you experience directly, okay? It was you was involved in it directly, or you witness somebody experiencing trauma, or you were there, maybe violence or fighting or domestic violence or deaths, So this trauma also can be natural disasters like tornadoes, could be airplane crashes, it could be fatal accident that involves injury. So also it could be accidental, or maybe it was intentional, maybe gunshots and stuff like that, So these are trauma-related incidents that you must have experienced or witnessed or you heard or somebody told you about your loved ones or your family member or friends, it's called trauma-related disorder, all right? PTSD happens to be one of them. Sometimes we think it's only military men or veterans or during war zones who normally experience PTSD, but it's not always this set of people alone. Anybody can go through trauma, maybe sexual violence, domestic violence, abuse. All of this can cause trauma, so we need to know that it affects your mental health too, So how do you know you're still feeling this? If things happen to you, sometime maybe up to a month, PTSD or acute stress disorder within a month, and the adjustment disorder, you're not able to go back to your normal life. How do you know you're still experiencing how do you know that some of the symptoms? Okay. So when some of these traumatic events happen, some people, they don't really want to explain, they don't want to feel that fear, they kind of cannot explain what they are feeling. Some people also know how to, endure trauma. They know how to just soak it in without telling others. But it's going to come up in another way. So another way these trauma-related disorders come up or they show up is a lack of motivation. You don't have any motivation to do anything. You just feel that this is the end of life for you. You're stressed out. You lack interest in everything that you used to enjoy. So it's some of the symptoms. Because some people don't express fear or anxiety over anything. They just kind of, suck it in that it's going to be okay. However, if you still feel like this, it's good to see your mental health professional or your doctor immediately. So some other symptoms are intrusive, distressive thoughts, Cognitively, you start thinking of negative stuff, You are unable to concentrate whatever you're doing. You can't be relaxed. These thoughts just come in whenever, just randomly, that something is still going on. And how often do they reoccur? Do they come, how was the frequency that you feel this? Also, do you experience any kind of flashbacks? That is, you see the events as if they are just re-happening again, as if it happened before. Like some people can just see it, see if they're imagining what just happened. Maybe something happened 1 year ago, but they're seeing reoccurring. It's a flashback about that event. Some people will avoid the places where it happened or the people or things, how, some people, for instance, maybe an accident happened on the highway, they might just totally not pass through that route anymore, things like that. So if you begin to feel all of this, then, it's time to see your doctor, right? Okay. So there is something also called negative alteration in your cognition and mood, which means you're unable to think straight. Your thoughts changes, your negative thought patterns. You're involved in thinking negatively about the situation, that you know something is wrong, or persistent negative beliefs about the situation. Oh, this thing happened because of me, or it was my fault, or you begin to feel shame or guilt for something that you did not do. All of this has to do with post-traumatic stress disorder, or any of the ones I've just counted for you. Okay. So there's also what they call marked alteration in arousal and reactivity. So which means you're always on edge. You are angry all the time, you feel sadness, you cry, all of that is also part of stress disorders. Or you cannot sleep, you cannot focus on anything. So it's time to see your family doctor or your professional mental health therapist or whoever that takes care of you, to help you with medication or what to do. Okay. Don't keep it to yourself. Get help. Get help to get out of the situation. I just told you, if you're experiencing all of this within a month of an incident, or at most 3 months, and you're still there in the same situation, then you know it's time to seek help. Please don't just leave yourself like that. Okay? So please, if you like this video, don't forget to subscribe and share. I'd like to also hear from you how this has helped you. Okay? As for me, like I always tell you people, I have verses I use for every occasion. If I ever experience anything, but I use Romans 8, verse 38 and 39, which says, I'm persuaded that nothing can separate me from the love of God, not even death, not height, not life, angels, persecutions, tribulations, principalities and powers, not even things that are seen and unseen can ever separate me from the love of God. So I hope you have a higher power that you talk to. For me, it's Jesus. So I wish you all the very best, and please seek help. I hope to see you soon. Don't forget to click and subscribe. And also, I'm leaving you with lots of resources. Click down below. Since this is PTSD Awareness Month, I have some resources down below for you, for parents, how PTSD is related to your parenting style, your relationship, problem solving, lots of podcasts and resources for you to use. I'll be so glad if I've been able to help you. Please let me know. Thank you. I'll see you next week. Bye. Take good care of yourself.